Hi, welcome to our first, and it may be our last edition of Off the Cuff. Off the Cuff. I have absolutely no notes, and I just spontaneously bring in a world-renowned expert to ask questions, and then this person off the cuff answers them, and then we edit as freely as we want to make each of us look really good. Take me through a basic rehab program if I'm having surgery or radiation or treatment. What's some of the basic things you offer?
Right. So one of the things would be if you take L-arginine, and you can take 500 to 1,000.
Ooh, that's a supplement.
I know.
The doctor just said that you might take a supplement that helps you?
Could be.
Winning. Anyway, so
now I'm your friend.
Now you're my
I'm really your friend.
But that makes a lot of sense because L-arginine creates a compound that widens the blood vessel, right? And brings more blood in. Exactly. So you actually, I know you have a whole bunch of options. As part of your rehab program, you offer the supplement L-arginine.
Correct.
Wow. And wow spelled backwards. Anything else you want to tell me about it?
No, it just helps to increase blood flow.
And it's cheap.
It's cheap, yeah.
So you just send them over the counter.
Right. So you can get 500 to 1,000 milligrams twice a day. I don't know what you tell them to take usually when
they have to take larger amounts because it takes a lot to convert to nitric oxide to make that effect. So I understand why you probably recommend. It kind of depends. We'll use citrulline, which is another product that does that. Mm-hmm. But arginine, unless you use those kind of dosage, the same dosages, you can't really get a good effect. So most of your clinical trials use those higher dosages. Which is anywhere from 3,000 to 5,000 to 10,000. Really? Yeah. And so wow. you have to use what you said, the grams. So 5 to 10 grams. It's not unusual.
Okay. So
you use that. Okay. And you tell them to take it every day?
Yeah.
Okay. And is this happening right after surgery, before surgery? I know it's not happening during surgery. That would be awkward. Yeah. But you're telling them to start it when? After a procedure or before?
I usually start after.
How soon after?
Once there's no bleeding, the drains are out and there's no bleeding going on.
So when they get a thumbs up that the catheter's out or no bleeding's happening, then you start L-arginine.
Right.
And what else?
And then I would start Cialis 5 milligrams daily.
Okay, Cialis 5 milligrams daily. Why do you like Cialis more than the other ones that have TV commercials?
Because it's a little bit more practical. And you could go even every other day because it has a longer half-life. It has 36-hour half-life.
Yeah.
Full life, 17 and a half hour half-life. But it's but you can take that. I would take it was me. I'd take it daily.
Okay.
It becomes expensive, but it keeps the blood flow there. And then I would start with a vacuum device, and we do what we call a 10-2-2 program. So you take the vacuum over the penis, and the whole idea is to get blood flow going into the penis. It's not to get an erection to use it, but you put the vacuum up against the penis, and you activate it either if you do the vacuum one, which is a battery-operated pack, or a hand pump, to draw blood into the penis. It's fresh blood. Hold it there for 10 seconds, and then you let it down. So you do a cycle of 1 there, and then you do 10 of those in the morning.
Wow.
And 10 in the afternoon or at night.
Does that take a while?
Well, it's going to take 10 seconds times
10.
10 times 10. Some people do it for 5 seconds. They hold it. The whole idea is to bring fresh blood in, let it down. It's going to take a few minutes to do.
Okay, so they're doing L-arginine every day.
Correct.
They're doing Cialis every day or every other day.
Correct.
And then they're using a vacuum erection device, which they can't pick it up at the store. In fact, the store ones make me nervous over the counter. You have to write them a prescription, right? Or not necessarily?
You can call. Now I think you can get them without a prescription. We just write it down and they can, on a prescription pad, and they can call. There's an Osbon company. There's a lot of different companies. They're a lot cheaper now because you can get them without prescriptions, I believe. And Medicare doesn't cover them now. So they used to cost $400. And I think you can get them for like $100 or cheaper now.
So that's not bad.
Yeah.
So the third thing is they're using the vacuum erection device daily, ideally. Is there a fourth thing? That's a lot.
That's about it.
So every man should be doing those three things?
I think that'll get them pretty much started and doing well.
Okay, so if you're about to be treated or have been treated, you're in your specialty, you're doing L-arginine, you're doing Cialis, you're doing the vacuum erection device, you better have your diabetes under control and your cholesterol under control and your blood pressure. You better take care of your business.
Right.
This has been another episode of Off the Cuff with Dr. Moyad. See you next time.